do a nasotracheal suctioning. And so before I begin, I always check the patient's charts and everything. And then I wash my hands. I wash my hands and then I would properly dry them, make sure it's completely dry before I put on my gloves. Then once I get my gloves, I'm going to properly put these on before I begin doing anything with the patient, with them. So once I'm ready, then I'm going to get the patient ready to go. So always with any patient, you always check to make sure you have the proper patient. So I'm going to always check their ID band. And then I'm going to get my tray ready. So here I have a nasotracheal suctioning kit. And so I have sterile gloves. So I'm going to make sure these are ready to go before I am ready to proceed with that. And then I also have my lubrication. Then I also can use a nasal trumpet if I have that available. So I'm going to go ahead and put the nasal trumpet in already. That way it's ready to go. So I'm going to take the nasal trumpet, and you can always tell by the size of the trumpet by checking by the nose to the earlobe here. And you can also check the bevel. If the bevel is too bigger than the nostril, then it's probably not going to go in very well. And then so this one here is just a little bit smaller, so it should go in good for the patient. So when I go, I can get it in lubrication, just that way it goes down smoothly for the patient. And then I always want to have the bevel side towards the middle of the nose. And so once I get it in there, I can push that down in there. Then that kind of also helps like with opening up the airway, so that way it can start the patient. So then I'm going to set up an oxygen mask. So I'm going to do a non-rebreather. Then with a non-rebreather mask, I'm always going to turn on and to make sure it is properly inflated. So then I will put it behind here to make sure I can get it around to the patient. And then I can go around like that to hyper inflate their lungs. So when I'm doing that, then I can get my suctioning kit ready here. So here I have the tubing and everything. So I'm always going to attach this to here, and I always need to make sure both the holes are plugged over here. Nothing is going to escape when I do the suctioning. So when I attach the tubing, I'm going to make sure I stretch it out a little bit, just so that way there's no kinks, nothing will get stuck when it goes into the proper disposal. So I'm going to turn this on to regulate, and I'm going to go to 120, and then I'm going to check it to see, I'm going to clue the opening to see where it lands at. I don't want to do more than 150 for an adult. So that looks good, it's at 150. So when I am ready, I'm going to just get this so that way I can properly use this. So I'm gonna before anything, I'm gonna always put the sterile water. I'll pour the sterile water into the tray, and I will get my lubricant ready on there before I remove my gloves. And I'm gonna remove these gloves, and I'm gonna dispose of them in the proper thing. And I'm gonna wash my hands, make sure my hands are nice and clean. And then I'm gonna get my sterile gloves on. So when I do put on my sterile gloves, I don't want to, try not to touch anything, the glove that I'm going to be placing the catheter on or anything, because then it will lose its sterile. So I'm going to get these on. Once I am ready, then I'll get the catheter ready. So I'm going to take the catheter and I'm going to connect it to the tubing. And you know it's connected when you start hearing the air move through this. And so then you can hear it every time I include the hole. And then I would take this and put some sterile water up through the tubing to make sure it properly sucks up anything that will be in the lungs. Then I'm gonna go ahead and lubricate the end of the catheter to make sure this will go down nicely. Then I would remove the oxygen from the patient. And then I would slowly move into the patient's nose. Now, if I come across that the patient gets stuck, I can have the patient cough. I can always check in the patient's mouth to see how far it is and if I'm getting stuck by something. So then I'm gonna go like this. I don't want to be in there for more than 15 seconds. So then I would slowly move the catheter out of the nose. And then I would like go over here and sterilize it to make sure I don't have anything on the end of the catheter. And if I need to, I go again. I can always place the oxygen back onto the patient to make sure it hyperinflates the lungs again. So then when I have this sterilized again, then I can remove this and go back into the patient's nose and go in slowly. And then once I'm down, I don't want to go in for more than 15 seconds like before. And then you only want to do this for 2 to 3 times. And so when I know I am done, then I can place the oxygen back onto the patient, because you always want to keep them oxygenated after you suction anything out of their lungs. So when I'm done, I am going to wrap this around my glove like this, so that way I have a good grip on it and I don't lose anything. And then I will remove it and I will dispose of the catheter with my gloves. And then once I am done, I can move this out of the way. And then I want to remove the oxygen, and then I want to get their breath sounds to make sure they are okay. And when I'm done with this, I always want to shut this off and shut the regulator off. That way it's not running. And then I'm going to assess the patient to make sure the breath sounds are sounding better. I'm going to report anything if I notice any difference in their lungs and the charts. And then I'm going to always check on the patient to make sure they need anything, and move the bed back down if they were laying down when we came into the room. So then when I'm done, I make sure everything's disposed of, and then I'd clean my hands and I'd be done.